Hello all, I am Dr. Yusuf Palkhi, a general gastrointestinal laparoscopic GI surgeon based with my head offices in Mombasa, but also do come to work in Nairobi. The other main focus of my surgery is bariatric surgery, which is related to weight loss, or what is also called metabolic surgery. All in all, we've been involved with the Kenya laparoscopic surgical services, and we work as a team. General gastrointestinal laparoscopic surgeon. Now, when looking at general surgery is very broad, but I've now mostly focused on what we call the gastrointestinal tract. So I deal with, and on that I then went ahead and specialized in laparoscopic work, which I've been doing for 20 years now. And the main focus initially was on gallbladder, hepatobiliary surgeries like appendicectomies, surgeries involving hernia repairs of different types in the human body. Also done a lot of work on what you call reflux or hiatus hernia surgery. And of course, we've kept on developing all this. But in the last 7 years, I took the initiative of starting bariatric surgery, which involves surgery for the obese people. Obesity is a big problem all over the world, and it's increasing at a very fast rate. Even here in Kenya, we are now having a lot of obese people, and the forecast is that they're going to be much more in years to come. Now, when it comes to bariatric surgery, we basically are doing surgery on patients who have reached a certain weight and height ratio, and on that basis we offer them different types of surgeries. The main ratio we use is what is called the body mass index, and this is based on the height and weight of the patient. So we use the same guidelines of the International Federation of Surgeons of Obesity. So if you are having a body mass index, basically body mass index is calculated from your weight divided by height squared. So let's say if your weight is 100 and your height squared is 20, then accordingly you will, not 20, but let's say 2, then your body mass index is going to be 50. So on that basis, if your body mass index is over 30, then you're already in the obese category. And once your body mass index is over 35 and you have diseases like high blood pressure, diabetes, then you will have to undergo a surgical procedure to bring your weight down. And the idea will be also to take away your diseases by doing that procedure. Laparoscopy has taken over most of gastrointestinal surgery now, whether it's anything to do with the intestines, but elsewhere in the world there would be like a branching, like there are laparoscopic surgeons who just deal with upper GI, so they deal with hiatus hernias, they deal with the stomach. Then there are places where there will be laparoscopic surgeons who are just dealing with the large intestine. There are laparoscopic surgeons who will just be dealing with the liver and the bile ducts. And there will be laparoscopic surgeons who will be dealing with this obesity surgery. But in Kenya, we have not reached there yet. And I am one of the persons who is trying to develop. But in the process, because we started this work 20 years ago, we sort of deal with a whole range of procedures. We hope to eventually, like for bariatric surgery, have a dedicated state-of-art bariatric center, which happens elsewhere in the world, where you have an in-house treatment just for people who are obese of all different ranges. So they can be just overweight and they still want an advice, they can come to that center. And of course, we hope also to train the younger surgeons who want to train in this work.